Okay, so let's start out. What is your name and what do you do?
I'm Jason and I'm a medical student.
Alright, and so what is something that you'd like to see change? And why are you here? What is something that you would like to see?
Well, I think like a lot of people here, I was really angry that it took a month for our president to develop a plan to bail out the largest corporations in the world, and it's taken more than 3.5 years, and we probably never will get a jobs plan. We need a political system that works for the average citizen and not for the politicians, not for the largest corporations. That's what I'd like to see changed.
Great. Do you have any ideas of some concrete steps that we can start to get towards that?
Absolutely. Corporations are not human beings. They should be held to different standards. The Citizens United case, there's a lot that can be done to regulate the power of corporations to get and their level of speech in our political discourse. There's a lot right now about this next election that's scary, and aggressive movement by the Federal Elections Commission could, I think, limit the extent of the corporate influence in our political system, just as a start.
So you'd like to repeal Citizens United?
Well, can't repeal it. Unfortunately, we have a Supreme Court that's above everything. But we do have a lot of flexibility within the Federal Election Commission on disclosure rules. And they may be able to spend as much as they want, but they shouldn't be able to do it blindly.
Okay, great. Any other specifics, policy or legislation changes, or reform in any form that you'd like to mention that you think would be good?
Absolutely. As a medical student, I think the most horrifying thing that's going on with our medical system is that we have we have millions of Americans that are uninsured. And fortunately, we had some movement 2 years ago to develop a system. It was as an example of how influential these corporations are in our political system, the bill was written, with them in mind. So we have, millions of more people who are going to have coverage through health insurance, but we also have, a diminishing standard of care because we're going to have, we have no true system of paying for decent health care in the country. So I'd like to see a government option, a public option, to address some of the deeper issues of our healthcare system that aren't being addressed through our political discourse right now.
Great. And so you're in med school. What's your focus, and what would you like to do?
I'm really interested in public health and preventative medicine. It costs a lot more to treat someone when they get sick, and we've lost sight of that in America. There's a lot of money to be made in the hospital when you can charge a lot for procedures that wouldn't be necessary if we had maybe a few more dollars to spend on prevention and good nutrition and programs where people could be healthy rather than sick.
Great. And what school do you go to?
I go to UMDNJ, New Jersey.
Cool. Thanks so much.
No problem.
Yeah, no,
Thanks for being out here.
Very well.